Hello, good morning. This is Dr. Tariq. Today I am going to talk about conduction system of the heart. The function of the heart is to pump the blood throughout the body. It contracts and relaxes. It keeps on contracting and relaxing throughout the day, throughout the life. This is because of the electricity that is produced in a system of specialized tissue that is present inside the heart. There is a aggregate of such tissue present in the roof of the right atrium that is known as SA node. It produces electricity at the wave of 100 beats per minute. 100 waves per minute. Every wave produces one cardiac rhythm. This electricity is not continuous. This is produced in the form of waves. The inherited speed of the SA node is 100 beats per minute. Then it goes to AV node, which is this is another node which is present at the base of the right atrium. SA node and AV node, that is known as AV node. SA node and AV node are connected with fibers. Some fibers also go to the left atrium. As right atrium and left atrium, they are near to SA node, then right ventricle and left ventricle, so they contract first, then the ventricles. That's why when they contract, P wave is formed, and when ventricle contract, QRS is formed. So electricity is produced at SA node, which is present in the roof of the right atrium. It goes to AV node, that is another node present at the floor of the right atrium. It produces electricity at the rate of 40 to 60. SA node, electricity production is the maximum speed, that is 100 waves per minute. So the rule of the heart is whosoever has the highest speed, that becomes the controller of the heart. SA node is produced naturally in with this capacity of producing 100 beats per minute. So it controls the heart, it controls the rhythm. That's why it is known as natural pacemaker of the heart. The quality of the AV node is when an wave is reached to AV node, it check it and stop it for a while. It delays, you can say, in other words. That's why AV node is known as gatekeeper of the heart. Then it allows the electricity to go down into the ventricles. The speed of electricity production at AV node is 40 to 60. That is not enough to carry out the daily duties of a person. Anyhow, this keeps the person alive. It means shift this patient to hospital for further management. From AV node, a bundle of such fibers, this is a specialized tissue. SA node, AV node, and all the system is made up of a specialized tissue which can produce electricity and distribute, but it does not take part in the contraction and relaxation of the heart. From AV node, the bundle goes to left ventricle in the interceptum, and in the interventricles, this bundle is known as bundle of his, or his bundle, because it was Mr. His who discovered it, and we attribute it to his name. This bundle in the septum divides into two parts, right and left. Right moves down to the right side of the septum, and left moves down to the left side of the septum. And when they both reach to the tip of the heart, they move to their respective ventricles. Left move to the left wall of the left ventricle, right move to the wall of right ventricle, and there they give its their terminal branches, which are known as Purkinje fibers. Purkinje fibers. And they are so numerous Purkinje fibers that each and every cell of the heart receive one Purkinje fibers. So electricity produced at SA node reaches to all cells of the heart within flash of a second, and the heart contracts and relax, contract and relax. This electricity completes one cardiac cycle, which consists of one contraction and one relaxation in 0.08 seconds. So I repeat once again, as in there is a specialized tissue which produces electricity and electrifies all the cell in the heart. A group of such cell is present at the roof of the right atrium, known as SA node. The heat electricity production at SA node is 100 beats per minute. This is known as natural pacemaker of the heart. The electricity produced at AV node is 40 to 60 beats per minute. SA node is known as natural pacemaker of the heart, whereas AV node is known as the gatekeeper of the heart because it delays every electricity coming to it. It checks it and makes some delay, then allows the electricity to go into the ventricle. So AV node is a standby generator. If SA node fail, AV node takes over the charge. But if both of the generators fail, in case, then any focus in the ventricle can take over the charge. These are Purkinje fibers. But the electricity produced by the Purkinje fibers is 20 to 40 beat per minute. And again, 20 to 40 beat per minute is not enough for the to perform the daily duties. That's why this is just a time being given to the patient. Shift this patient to hospital for further management. This conduction system does not take part in contraction and relaxation of the heart. It just produces electricity, distribute to all part of the heart. SA node, natural pacemaker of the heart. AV node, gatekeeper of the heart. And electricity is at SA node is 100 beat per minute. Electricity production at AV node is 40 to 60. Electricity produced in the ventricle is 20 to 40. This is all about conduction system. Thank you very much.